Causes of E. coli outbreaks. Escherichia coli. E. coli outbreaks are typically caused by the ingestion of food or water contaminated with pathogenic strains of the bacteria, particularly E. coli 0157H7. Common sources of infection include raw or undercooked meat, especially beef, like hamburgers, is a major source, as cattle can harbor E. coli in their intestines. Unpasteurized dairy products and juices. Fruits and vegetables, especially leafy greens, can be contaminated through contact with contaminated water or poor handling practices. Raw sprouts have been linked to outbreaks due to contamination during the sprouting process. Drinking or swimming in contaminated water, including rivers, lakes, or poorly treated public water supplies. E. coli can spread through improper hygiene, especially if an infected person handles food or uses public facilities without washing hands properly. Poor hygiene, inadequate washing of hands, improper storage, or cross-contamination during food preparation can facilitate the spread of the bacteria. Symptoms of E. coli infection: diarrhea, often bloody, abdominal cramping and pain, vomiting, fever in some cases. Severe cases can lead to hemolytic uremic syndrome (HUS), which causes kidney failure, especially in children and the elderly. Management of E. coli outbreaks. 1. Prevention, food safety. Cook meat, particularly ground beef, to an internal temperature of at least 160 degrees Fahrenheit 71 degrees Celsius to kill bacteria. Wash fruits and vegetables thoroughly, especially leafy greens. Avoid raw or unpasteurized dairy and juices. Practice good hand hygiene, especially before eating and after handling raw food. Prevent cross-contamination in the kitchen by using separate utensils and cutting boards for raw meats. Water safety. Drink treated or bottled water if unsure of water quality. Avoid swallowing water in recreational swimming areas. 2. Treatment. Most cases of E. coli infection are self-limiting and can be managed with supportive care, such as hydration, oral rehydration solutions, or intravenous fluids if necessary. Pain relief: acetaminophen for mild pain, but avoid NSAIDs as they may worsen kidney complications. Antidiarrheal medications are generally avoided as they can prolong the infection. Antibiotics are not recommended for E. coli 0157H7 infections as they may increase the risk of developing hemolytic uremic syndrome (HUS). Close monitoring is needed, especially in vulnerable populations, children, the elderly, immunocompromised individuals, for signs of HUS, which requires urgent medical intervention, including dialysis if kidney failure occurs. Outbreak control. Health authorities may issue warnings or recalls for contaminated food products. Quarantine and isolation measures for individuals or institutions affected by the outbreak, for example, schools, restaurants. Investigation of the source of contamination and tracking of affected individuals.